My name is Daniela Molena. I am a thoracic surgeon at Memorial Sloan Kettering Cancer Center, and I am also the director of esophageal surgery in New York. We are a ASCO GI 2026, and today I'd like to describe a little bit our session on the role of surgery in patients that had achieved a complete response after chemotherapy and radiation. This is a very important issue because this kind of cancer is very aggressive, and we don't want to miss the opportunity of curing our patients. And the concept of clinical complete response, it's a little bit tricky concept because although we don't see any cancer in imaging or on endoscopies and on biopsy, we really cannot be sure that the cancer has been completely eradicated. And so the role of surgery in these situations is really to eradicate fully the disease and also the lymph nodes in the surrounding area, because at the time when patient has completed treatment, it is the best time to do the operation because the tumor is suppressed, and so you get the best advantage of the treatment that the patient has received. And then resection basically get rid of where the tumor has originated and all the surrounding lymph nodes. And those patients that actually achieve a pathological complete response, which means there is actually no detectable cancer on pathology, which is very different than imaging, those patients after surgery do the best. They have the largest life expectancies and the best prognosis. So can we salvage the organ, right? That is always a big question. And I am totally, I'm a surgeon, but definitely I want the best for the patients. I want them to do well and live a long and happy life. And I think the issues that we're facing today is that really our tools are not good enough today to know for sure when a clinical complete response actually is also a pathological complete response. And until we have those tools, I think the safest thing to do is to do surgery, because you might miss the opportunity to cure the disease. Sometimes, the disease keeps on growing, and by the time that you take the patient for surgery, if the surgery is still possible, because sometimes it's not, we find that the tumor, and this we did it in our own study at Memorial Sloan Kettering, the tumor was more advanced, more aggressive, more lymph nodes were involved, and really you do this big operation that definitely has some risks and did not achieve the same results that you would have done if you had done the surgery right away in the beginning. So I think that today is still a little bit risk approach to do it that way. Whatever, though, our patients are very high risk surgical candidate. So I think that at the end, although this was a debate, we came to some agreements, right? There are patient and patient, there is disease and there is disease. And it's so important for us clinicians to have a frank discussion with our patient and make that decisions together. And I told, the community is kind of balancing a little bit the risk of cancer cure and the risk of surgery, right? And so every patient have a different risk for surgery, and every patient have a little bit of a different risk for cancer recurrence based on the disease severity and type of aggressivity that the biology of the tumor has. And so those discussions are very important with our patients. But for me today, we're not yet there to say for sure, when there's no cancer visible on imaging, that you do not have cancer. And so the thing that makes me most sad of all is to have missed the boat, right? And then see patients back with tumor somewhere else in their lungs, in their liver, or in different regions, and now surgery is not feasible. And that it's really sad because we missed the opportunity. And we talked about quality of life and adjustment after surgery. It's definitely, not like having your full stomach, or it's not like having your normal anatomy, but patients that live, they will adjust. And time, I always tell patients, is their best friend, because things get better and better and better as the time go on, and you adjust to your new condition. It's the new normal, and people live with it and have a good quality of life, and especially if cancer doesn't come back.